Welcome back, everybody, to another daily deep dive into the latest healthcare news. Today, we're going to be looking at AI, and oh my gosh, is there a lot of news about this right now? We've got articles piled up here from Raman Healthcare, Kevin M.D. Becker's Hospital Review, so many more. It seems like everyone's talking about this.
It really is. Everywhere you look right now, AI is impacting healthcare in a huge way. I mean, everything from how hospitals are run to the really cutting-edge research that's being done.
Yeah, so let's jump right in and start with this story about MUSC Health. It's a pretty big hospital system with 16 hospitals, and they were actually facing a pretty big loss, like $30 million loss.
Oh, wow.
But they managed to turn things around and become profitable within a year.
That's incredible. A complete turnaround in just 1 year.
And get this, AI was a big part of their success.
You know, it's a perfect example of how AI is not just some far-off idea. It's here, it's happening now, and it's making a real difference.
Exactly. And we're not just talking about robots doing surgery or anything like that. It's more about using AI and all this data to find ways to be more efficient, streamline all those operations, things that humans just can't do as quickly or as accurately.
Absolutely. It's about using data to make smarter decisions.
And it's not just MUSC Health either. We've got Press Ganey, too.
Oh, yeah. Those guys are big in the patient experience world.
Exactly. And they've partnered up with Microsoft to develop some new AI tools.
What are they trying to do with these tools?
Well, the big focus is on improving safety and the quality of care, and of course, making sure patients have a better experience overall.
That makes a lot of sense. AI could really help personalize things and make sure patients feel heard and taken care of.
It's amazing to see how AI is being used to improve so many different aspects of healthcare.
Yeah.
But it's not all sunshine and roses, is it?
Well, yeah, there are definitely some concerns, too.
Like this investigation in Australia at Mackay HHS.
What happened there?
Well, some doctors are raising some red flags about how much AI is being used in healthcare.
Like they're worried it's going too far.
Yeah, they're questioning, how much AI should actually be involved in patient care and how these tools are being brought into the system.
It's a really important point. While AI has so much potential, we can't just jump in without thinking about the possible downsides.
Right. It's all about responsible implementation and making sure we're not moving too fast without considering all the angles.
Absolutely. And one of the things that people are starting to talk about more is this idea of AI hallucinations.
AI hallucinations. What's that?
I know it sounds kind of wild, right? It's basically when AI systems spit out information that's just plain wrong or misleading.
Oh, wow. In healthcare, that could be really dangerous.
Right. And there's an article by Howard Taylor. He's the CISO of Radware, and he's really sounding the alarm about this threat.
So it's not just some theoretical problem. It's a real concern.
Yeah, I mean, think about it. Healthcare decisions can be life or death, so we can't afford to have AI making mistakes.
It's a stark reminder that we can't just blindly trust these algorithms.
No, we need to understand their limits and make sure there are safeguards in place to catch these errors.
So let's shift gears a bit and talk about AI in research and treatment.
Okay, sounds good.
OpenAI just came out with this new tool called Deep Research, and it's causing quite a stir.
I've heard about that. What's so special about it?
Well, it can basically do online research, like a superpowered research assistant. It can sift through tons of data from scientific papers, clinical trials, medical databases, all that stuff, and it can do it way faster than any human could.
So, what takes a human researcher hours, this tool can do in minutes?
Exactly. It's incredible. It has the potential to really speed up scientific discoveries.
That could be huge for drug development, finding new treatments, understanding complex diseases.
It really sounds like science fiction becoming reality.
It does, doesn't it? But as with anything this powerful, we have to be cautious, too.
What do you mean?
Well, for example, we need to make sure that the data used to train these AI systems isn't biased.
Right, because if the data is biased, the AI's conclusions will be biased too.
Exactly, and that could lead to all sorts of problems.
So accuracy and addressing bias are absolutely critical. What other news do we have in research and treatment?
Well, there's a presentation happening at ICIT 2025 by Dr. Kek Ki-young about using AI to treat peripheral arterial disease, or PAD.
PAD, that's a serious condition.
It is, and this is a great example of how AI is moving out of the research lab and into the real world of treating patients.
It's exciting to see AI being applied to these real-world medical challenges. Are there other areas where we're seeing similar progress?
Absolutely. UW-Medicine and Fred Hutch are launching a new skin cancer institute.
A whole institute just for skin cancer.
Yeah,
Wow.
it shows you how much progress is being made in areas like cancer treatment, and a lot of that is driven by AI.
Even if they don't always mention AI directly, it's often working behind the scenes.
Exactly. AI is everywhere, even in the FDA's recent approval of a new drug called Eftosma.
What kind of drug is that?
It's a biosimilar for tocilizumab. It's used to treat things like rheumatoid arthritis and giant cell arteritis.
So even in the world of pharmaceuticals, AI is making its mark.
Definitely, it's being used in drug development. Personalized, prescribing, all sorts of things.
It's clear that AI's influence is growing rapidly in healthcare.
It is, and it's touching every part of the industry in ways we're only just beginning to understand.
So much to think about, and we've only just scratched the surface. What can our listeners look forward to in the next part of this deep dive?
Well, we're going to take a step back and look at the bigger picture. We'll explore what all these individual news stories mean for patients, providers, and the future of healthcare as a whole.
Sounds fascinating.
Yeah.
Can't wait to dig into that. So be sure to join us for part 2 of our AI and healthcare deep dive, where we'll be delving deeper into the challenges, opportunities, and the ethics of this revolutionary technology.
So, we've been talking about all these different news stories about AI and healthcare.
Yeah, it's a lot to take in.
It is, and I think it's helpful to sort of step back from the individual stories and look at the bigger trends that are emerging.
Okay, so what are you seeing? What's the big picture here?
Well, the main takeaway, I think, is that AI is becoming really deeply embedded in the healthcare landscape. It's not just some futuristic concept anymore. It's a reality that's changing how we approach patient care research, even the business side of healthcare.
Yeah, I mean, we saw how AI helped MUSC Health become financially stable, and how Press Ganey and Microsoft are using it to improve the patient experience. And then there's OpenAI's deep research tool that could revolutionize how scientific discoveries are made. It's incredible how fast this technology is advancing.
It is, and it's affecting every aspect of healthcare. But with all this progress, it's important to think about what it means for the people who are actually navigating the healthcare system.
So, what are the implications for patients, providers, the industry as a whole?
Right. For patients, AI could mean faster and more accurate diagnoses. It could lead to personalized treatment plans that are tailored to their individual needs. And we might even see virtual assistants that help patients navigate the complexities of the healthcare system.
It sounds like AI could really empower patients and give them more control over their healthcare journey.
Exactly. But it's crucial to remember that AI is just a tool, and like any tool, it can be used for good or bad.
Right. We talked about those concerns earlier, like the potential for AI hallucinations and the need for safeguards to ensure that AI is accurate and reliable.
Exactly. We can't just blindly trust these algorithms. Patients need to be informed and engaged, ask questions about how AI is being used in their care, and demand transparency from healthcare providers.
So basically, everyone needs to stay informed about AI and healthcare. What other implications should we be aware of?
Well, AI also has the potential to change the doctor-patient relationship. As AI gets more sophisticated, it could start taking on tasks that were traditionally done by doctors, like diagnosis or treatment recommendations.
That's interesting. Will it enhance that human connection between doctors and patients, or will it create a distance?
That's a tough question, and there's no easy answer. It's something we all need to think about as AI continues to evolve.
For sure. AI seems to present both opportunities and challenges for the healthcare industry as a whole. What are some of the bigger things we should be considering?
One major concern is that AI could make existing healthcare disparities even worse. If the data used to train these AI systems is biased, then the AI could perpetuate and even amplify those inequalities in access to care and treatment.
That's a really important point. We need to make sure that AI is developed and implemented in a way that promotes equity and fairness for everyone.
Absolutely. And we also need to be mindful of the economic implications. AI has the potential to automate a lot of tasks in healthcare, which could lead to job displacement in certain sectors.
Yeah, that's a valid concern. How can we make sure that the benefits of AI are shared equitably and that we don't create even bigger economic divides?
It's a complex issue that requires a lot of thought. We need to think about retraining programs for workers who might lose their jobs because of AI. And we need to find ways to create new job opportunities in the fields that are emerging because of AI.
It sounds like the widespread adoption of AI will require a major shift in how we think about healthcare.
We need to be willing to learn and adapt as AI continues to reshape the healthcare landscape.
And it's not just about implementing new technology. It's about transforming the way we think about healthcare delivery research and the roles of both patients and providers.
Exactly. It's a journey that we're all on together.
This has been a really thought-provoking conversation. As we move into the final part of our deep dive, What are some key takeaways for our listeners to keep in mind?
I think the most important message is that AI is here now, and it's transforming healthcare in big ways.
It's not something we can ignore or dismiss.
We need to engage with it, understand its potential and its limits, and make sure it's used to benefit humanity.
And that means staying informed, asking critical questions, and demanding transparency from those who are developing and using these powerful technologies.
Exactly. The future of healthcare is being shaped right now, and we all have a role to play in making sure it's a future that works for everyone.
That's a great point. Stay tuned for the final part of our AI deep dive, where we'll leave you with a thought-provoking question to consider as you continue to navigate this rapidly evolving landscape. Wow, we've really covered a lot of ground in this deep dive. From hospital efficiency to cutting-edge research, and even the potential impact on the doctor-patient relationship, it's clear that AI is changing healthcare in a big way.
Yeah, we've seen both the amazing potential of AI, like how it can improve patient care, speed up scientific discoveries, and even help hospitals with their finances. But we've also talked about the need to be careful, highlighting those concerns about AI hallucinations and the potential for bias to make existing healthcare disparities even worse.
It's a good reminder that every new technology comes with a responsibility to use it wisely and ethically.
Absolutely. And as AI gets even more advanced and becomes even more integrated into healthcare, that responsibility is only going to grow.
So as our listeners are thinking about all this and as they start to encounter AI more and more in their own healthcare experiences, what's like the one big question they should be asking?
Hmm, that's a good question. I think the most important thing to ask is this. How do we make sure that the human element of care stays at the forefront, even as AI takes on more and more complex tasks in healthcare?
That's deep.
Yeah, how do we balance the power of technology with the things that are so essential to healing, like empathy, compassion, and real human understanding?
It makes you think about what kind of healthcare system we want to build. One where AI helps humans do their jobs better,
Hmm.
not one where AI replaces humans altogether.
Exactly. The future of healthcare isn't about choosing between humans or machines. It's about figuring out how they can work together in the best way possible.
So it's not a competition, it's a collaboration.
Right. And it's a conversation that we all need to be part of.
Yeah. Well said. This has been a really fascinating and thought-provoking discussion. So as we wrap up this deep dive into the world of AI in healthcare, we want to leave you with that thought-provoking question. How can we make sure that even as technology continues to advance, the human connection that's at the heart of healthcare remains strong and vibrant? Thanks for joining us on this journey, and we'll see you next time for another deep dive into the latest healthcare news.